Hi, hello everyone. So I came across this letter, my first appointment letter as a nephrology nurse. That's renal nurse. And that was in 2014. Apparently, I was actually earning 100,000 per month as at the time. Well, with the economy in 2014, things were so cheaper compared to this economy because transport fee was so cheap. Dugbe to area one at the time was 100 naira. Rice, exchange rate, everything was just, normal and good as compared to this economy actually. And of course, I spent 10 years in dialysis units. I spent more than 10 years because that was in November and we are in December already. So that was more than 10 years. With my experience in dialysis unit, working in dialysis unit in 10 years, I want to actually tell us some things that usually bring people to dialysis units, as well as how people present to the hospital, and of course, what helps people to cope with their therapy. I would like to tell us, and finally, to allay the fear of unknown of anyone that is willing to explore their options in kidney transplant as a way of renal replacement therapy. Yes, first and foremost, I would like to actually talk exclusively, although brief, about what brings people to dialysis units. Majority of people actually present to dialysis units on account of hypertension. I will not even lie, it's something we've been talking for years. People refuse to be checking their blood pressure. People that check their blood pressure neglect. They don't take their medication as prescribed. And of course, some people that take their medication as prescribed who eventually ends in dialysis unit must have spent years of managing. Sometimes some people might actually manage blood pressure for 12, 20 years, 25 years, before they actually comes to dialysis. But majority of people in their 40s, some don't actually take care of their blood pressure. Like some don't even know they are ready. When they even know that they have the history of hypertension in their family, they don't pay attention to it. It's something that is sad because every now and then people keeps coming to dialysis units with hypertensive urgency, chronic kidney disease secondary to hypertensive urgency, uncontrolled hypertension, poorly treated hypertension, all those things. Another thing is diabetes. People comes to dialysis units based on complication of diabetes. Uncontrolled sugar to damage the nerves, damage the blood vessels to the kidneys, and of course, the kidneys will fail. Also, people present to dialysis units on account of abuse of all these NSAID, all these drugs analgesic that are harmful to the kidneys. So people come. Also, people come to dialysis units on account of HIV. We call it HIV associated nephropathy. Sometimes it may be due to the virus itself or due to the antiretroviral. Some antiretroviral can increase the creatinine. Once the creatinine is high, that's to tell that the kidneys, the antiretrovirals is actually affecting the kidneys. So if you are able to check your antiretroviral, maybe within 3 months or no 2 months of using, if you are new to the drug, always check. Or if they change your routine to another, always check so that you will know if the drug is having effect on your kidneys and they will be able to change for you. So that's by the way. Patients in Nigeria, patient presents when they're actually in bad shape to the hospital. when it comes to kidney failure. You will see people, they will come when they are already unconscious, or when they cannot, they can't speak coherently. So that's when some actually present to the hospital. Sometimes people come to the hospital, people neglect, or they take the symptoms of kidney failure to that of malaria, and so when they've already bombarded them with a lot of medications, that's when they will now land in dialysis units. So please, not everything is malaria. If you are sick, go to the hospital, let them check you appropriately, instead of them, harming the kidneys the more. So over the time, people, sustain more on dialysis when there is support from family, friends. Not just about finances, emotional support, psychological support, they need support. And that's by the way. Also, over the period of years, I've known people that, of course, explore their options in kidney transplant, and they are still doing so well. Yes, I spoke with an elderly man about 2 days ago, and he's still doing well after 6, 7 years of transplant. So that's that. In my 10 years, I've actually summed up these experiences and be able to write this book. You are seeing, I wrote this book about the kidney care, what we can do to keep our kidneys healthy in order to prevent the prevalence of this disease. And also, I personally, I based on the ignorance, I took it upon myself to go out, to educate people, to check them, to screen them, anyone that may be at risk of chronic kidney disease. So I have a foundation named Omotayo Kidney Care Foundation. It's registered, so we focus on preventive nephrology. Enough of people coming to dialysis unit. The care is not cheap. The treatment is not cheap. It doesn't even have a cure. So the treatment is not cheap. So I have a foundation that focus on preventive nephrology, and we move about, screening people that may be at risk of chronic kidney disease. We check their urine, we check their blood pressure, check their body mass index. We educate them basically. And like I said, I wrote this book. This book is 2,000 naira. I put everything I've gathered together in order to care for our kidneys. I put them in this book. Please, you can get a copy for 2,000 naira. And in next year, my channel, I have a channel on YouTube. My channel is actually working towards, it's already ongoing. So we want to start inviting people that have been on therapy for years to speak about their experience and how it can encourage others.